I will make sure we cover it if there are things that you want to cover tonight, as you've been studying, or maybe some concepts that are a little more difficult that you would like to discuss. I can definitely pull questions as we go along. If there's a like, hey, Dr. Boone, I want more questions in this area. Do you have any? Um, I have so many questions. The other thing I want to highlight was that kind of how to use questions. So the reason that I want you to use do I talk about it? No, I don't talk about it. The reason why I want you to use questions is because it helps you practice. It really does help you practice. So, yes, I want you to study, but I also would like you to take practice tests. You should be able to take at least two full practice tests before your exam, just to give you some experience with being nervous, and just having different things come up. You can't really mimic the exact, of course, day, but wanting to give you kind of how it feels to sit through 4 hours, because it's a lot. It's a lot to do. And especially if you are more of a person that likes short things, like you've been studying like 15 minutes at a time, like on your way to things, like multitasking while studying is great, but I want you to also get practice with sitting for 4 hours. And there's a couple ways that you can do that. One, I have a full practice exam on the Kajabi site. For some reason, because it's um kind of longer, um, and I do have the two parts. So I'm gonna split it up into 285 so that you'll be able to take it better. I think it's just sitting at the computer. Sometimes your computer times out or your cookies or whatever. So when you do it, try to, if you have Google Chrome, try to do an incognito window. Sometimes that helps in terms of making sure that it like goes through. So that's what I would say too with your quizzes, because it is a kind of a longer quiz. Um, but so you have that as a full practice exam. Also, ASWB has the practice exam. It's $85, but it really is beneficial. Um, However, it, to my knowledge, has not changed in years. Um, and so if you've already taken it recently, I wouldn't like retake it or pay for it again. But if it's been some years since you've taken it, then you might want to reconsider possibly taking that. And the reason why I always recommend it is because it's coming directly from the source, directly from the agency that's making the questions. And so it's like the closest thing you can get. The questions are retired, but you only have one time to take it, and you want to maximize that one time, but you do have 30 days after you launch it so that you can go back in and really study kind of what the rationales are. I'm not sure if the practice splits it up into the two parts like the exam does. Um, if I had to guess, I would say no, and I haven't heard that the practice exam mimics that part of the exam with the break in the middle. But just wanting to point that out, that not all questions are created equal, and that your closest thing is going to be that ASWB practice exam, and that a lot of your material that has questions is going to be testing your knowledge, not necessarily having the format close to what it looks like on the exam, which can also be confusing if you're studying more for the knowledge and not, but you're not practicing your strategy and how to break down the questions. You don't want to find yourself in that situation. So we use the like method. I think everyone's pretty familiar, but just I always just put it in there. This is the free study resources. Um, Again, things that you can maximize for not spending a whole lot of money. And each of these resources, like Behavioral Health app, Agents of Change, Phil Luttrell, they all have their own questions and have mechanisms for you to be able to use those. And RayTube too, I think. RayTube also. We're gonna go over tips as we go, but I do want to highlight just a few things. If you find yourself stuck and you're like, what in the world is this? Right? You're really like, oh my gosh, it's like 10 sentences. What is happening in this question? Think about what the main issue is. Don't get caught up in the additional information, and this takes practice. But you want to really ask yourself, what is the presenting problem, and how does the answer I selected address it? We've gotten a lot of practice with first questions. I think we are pretty good with identifying that we're in an assessment stage, and kind of seeing what stage we're in. Um, Most and best, however, can be a little tricky. With most and best, all of the options may be true, okay? But you want to answer based on what is highly associated with the key concept. So you really have to figure out what is the question asking. Remember, for example, we talked about if the client has a quote, like they have just said something to you, then probably the best action is going to be to address what they just said. Or if a client asks you something or requests something of you, then typically the answer is going to be to fulfill that request with whatever is appropriate. Some questions may be asking you to identify a general answer. Sometimes it's not the answer if it's like super, super specific. Again, with most and best. And these are just things to keep in mind because they can be a little tricky. Like if you're like, oh my gosh, what? This is crazy. These are just things that I'm little tips, little tips. Always select an answer that focuses on the client, right? Unless you are sure that the question is really about you as the social worker, maybe you're having some type of counter transference issues, or the issue is with you as the staff. If it says, what should the social work supervisor do? Obviously, that may or may not be directly about the client, it might be about the staff member. But typically, generally, pick what focuses on the client or is client centered. Another tip for most and best is look at the second to last sentence. So, we normally say, right, the L in liked is to look at the last sentence. But when you are trying to figure, like if you're very confused as to what is asking you or you need to be focusing on, sometimes, not all the time, sometimes there is that sentence, and that's exactly what you should be focused on. That's what the answer is based on. But it's not 100%. So I don't want you to be like, Dr. Boone told me to look at the second to last sentence, so that's all I look at. No. Just when you're stuck. If you're getting stuck, these are just some ways to possibly get unstuck. Common errors. We've talked about all of these. What I want you to practice tonight is not second guessing. If we can help you to not second guess and to trust your gut, trust your knowledge, and have that positive self-talk in terms of what you know and what your ability is, that's going to really be, I always talk about this, more important than the information. More important than the information you are learning, right, for the exam is for you to actually believe that you can answer the questions correctly. That's really important. Okay, when the fully licensed social worker have dilemmas, should they seek the supervisor, or since they are fully licensed, they will consult? Has a dilemma. It just depends on it depends on what the scenario is talking about. So, so if we're talking about I have an issue with a specific population or a specific issue, typically the answer is consult with an expert, right? So let's say I've never had a client who is in this particular cultural group that's different than me, and I'm having some difficulty with engaging the client, then I might consult another social worker that has experience. That's really important. They have to be an expert. So sometimes you'll see that's the answer. But if it's like I don't know what to do, um, again, it's going to depend on your options. An ethical dilemma, your first go-to is to consult the code of ethics. But normally it doesn't have that as an option. So then your supervisor might be good. It probably isn't going to say you are fully licensed, like in the question. It's just going to say that you're a social worker and you're having this issue. Sometimes it wants you to actually work through the ethical decision making model, and consult or seek a supervisor might not even be on there. So they might actually want to see that you know what the steps are, um, in terms of figuring out what values or principles are involved, looking at what is going to do the least harm to the client, being able to exercise that action and then evaluate to see if, what the impact was. But generally, it'll be consult, could be a supervisor, or could be a social worker that is an expert in the area. Um, or it could just be that you have to actually work out the dilemma. So it just depends on the scenario and your options, really. The answer options is key too. Okay, so let's go ahead and start our questions. Like always, we are going to use the polling site. So I'm going to put the polling link in the chat. This is just a way for me to quickly see kind of where everyone is. Do we need to go over this some more, like in more depth, or are we pretty good and we can move on to the next question? But please let me know if you have any questions, and we'll definitely pause. Sorry, I gotta get the link. We'll definitely pause if you have any questions that we need to review. I'm going to give you 45 seconds. Let me put the link in the poll. Okay, the link is in the chat. It's one link for the rest of the night, but sometimes you'll have to refresh it. All right. So this is a next question. So we need to be putting these in order. Tell me what type of question this is. Safety. Perfect. Which of the answers are safety answers? I'm here to tell you all of them. So we really do have to put these in order. So we have clarify whether the client has an immediate access to the medication described in his plan. B, begin completing a safety contract with the client and schedule a follow-up appointment. Or C, contact emergency services to initiate an involuntary hospitalization. So two of them say that we need to do something immediate because our client is a high risk, right? Or appears to be a high risk. And one says they are a low risk. B, we're going to do safety contracting if our client is a low risk. But we see that our client is getting things in order and wrote a goodbye letter. So we know that it requires just a higher level in terms of assessing what is really happening. So A says to clarify the plan, right? So we see that he shares that he has been thinking about ending his life by overdose on prescription medication. So A is saying, is this something that is feasible? Do you have access to this plan? Is this plan able to be carried out? When we have ideation, we have a plan, we want to see if there is access to how they would actually carry that out. And so the answer would be A. The exam is very order based. So it's really important for you to know what to do when you have a client that has expressed suicidal ideation. We have a plan. We need to know if this plan is going to be feasible or possible because we are still assessing. A basically means we're still assessing the risk of the client. C, we would probably do C maybe later, but we have to know kind of is what do we have here? Do we have a situation where we need hospitalization or not? And so A is important. So, number one, when you have a suicidal ideation, you would ask for a plan or assess if there is a plan. So we see here that we already have a plan. Overdose by prescription medication. And so A just simply means that I'm going to clarify in terms of, is this medication you have in your cabinet? Like, do you have access to this medication? Is it someone else's medication? Um, like what is this? Is this something that you could literally go home and do? Or was this just something you were thinking about, but not actually trying to carry it out? But it looks like the other like getting things in order, writing a goodbye letter, that is definitely like, oh, it's definitely something going on. But the exam wants to make sure that you're following all the steps before doing C, right? So let's go back because next was right here. Consider next like first, right? So what would I do first after what I just heard? Okay. If you're still in the session, stay in the moment. And we know if it's a safety question, we're going to act immediately, but next means something immediate. It can be difficult because you know that this client appears to be high risk, right? But what it's basically saying is that you're still assessing. A means you're still assessing the risk. C would be appropriate if we had already determined that the risk was high. And we had ideation, a plan, and access. So if we already had all three of those things, then we would be like, okay, I'm at the point where I need to do some, get some other type of authority involved, like 911 or some type of involuntary thing needs to happen. So you want to have all of those things in place, because like typically in a safety question, not all the answers would be safety answers, and so you would be able to kind of differentiate. This question in particular, I wanted to make sure you knew all of the steps because the exam is very step oriented. And when you see first and next, almost think about it as you need to slow down, like slow yourself down. What are the steps? What needs to happen in this situation? Have I done all of them? Is one of the steps in the answers? Then I need to do that before I kind of jump to the end result, right? Because probably what's going to happen is C, but we want to make sure we're following those steps in terms of evaluating the current level of danger, because that's what we're doing. Okay, let's do number 2. Tonight's questions are designed to get you to think. So, um, we might have some doozies, but it's designed to get you to think. Wanting you to slow down. We've learned a lot over the last 4 or 5 weeks, and so wanting to make sure that your processing is correct. So what kind of question is this? Clinical. Um, it's a direct practice question, right? Um, so when you say clinical, you probably are meaning like practice. So it's a direct practice question. Yes. And you eliminated A and C. Yeah, that looks to be what everyone did. Eliminated A and C. So perfect. A is an intervention. C is assessment, further assessment. Typically, we're not going to do a psychiatric evaluation unless we see something that's um, some type of psychotic features, typically, is what will spark that. So A and C are out. Now we have B and D. Um, so since we're in the practice, it's a practice question, we want to identify what stage of practice we're in. I think by you eliminating A and C, I think we're all in agreement that we're in the assessment stage. And so in the assessment stage, um, we want to make sure that we are assessing for the presenting problem. So the presenting problem is that our client has a long history of depression. Okay. Um, and so we want to make sure that we are assessing for in a holistic way. So this is not popular, but the answer is D, conduct a comprehensive assessment. Now, what you're going to tell me is, well, Dr. Boone, you said when there's quotation marks to pay attention. I did say that. And you said we should address the client's feelings. But let me show you that B is not a feeling answer. B is an assessment, right? You're trying to figure out, okay, this is the presenting problem. This is what the client just told me. And so now that I have a little bit of information, Lord have mercy, it's okay. Now that I have this little bit of information, I want to make sure that I'm assessing for the most what will give me the most information so I can understand where the depression is coming from. Because B is basically saying, well, I'm going to explore this first so that I can explain the depression. But when we are looking to assess, this is my tip. When you're looking to assess, you want to do what gives you the most information. So in doing D, we probably are going to do B, right? If we're doing a comprehensive assessment, we're going to talk about the romantic relationships. We're going to talk about social relationships. Yeah, I second guessed. It's okay. It happens. It definitely happens. But now you know that when you have two assessments, you want to go with the one that gives you more information. B, what normally trips people up is B sounds like you are validating feelings, right? Because the client just said, I've never been in a close, emotional, intimate relationship. I just don't think I'm wired that way. And so it does talk about feeling emotionally disconnected. Right? Yeah, I know. The client says that they're feeling emotionally disconnected, right? But it doesn't say that you are validating the client's feelings. You're trying to figure out if that has to do with the depression, right? That's really what you're trying to do. Is this emotional disconnectedness? Is this why you're depressed? That's really what you're trying to figure out. But a comprehensive assessment will show, is this really the reason, or are there other factors? Do you have family relationships? Do you have maybe some childhood stuff that's kind of coming up and affecting these things? Because it says that the client has a stable job, good physical health, some friendships, um, his daily functioning is fine. He appears calm, but somewhat distant. So you're just trying to figure out like where you're okay, but then you're not, you're having some issues. So where are these things coming from? And you want to make sure that you're doing a good job of assessing everything and not just being like, well, this is what the client said, and therefore that's why. That's where it's coming from. And as a therapist, or if you've ever been in therapy, that's what they do, right? You might say, well, this is my problem, right? This is my issue. But they're going to dig, dig, and dig, and dig and find all sorts of things that you're like, oh, well, it could be that. And it also could be that. Or it could be a combination of all these things, right? All these things are impacting your ability to connect, right? Um, Maybe the client has some attachment issues, right? And so that we would have to kind of really dig to figure out, is this why the client is depressed? Like, why is there a long history of depression? Where is it coming from? So, number one, keep in mind your presenting problem. When you have two options that are assessment, pick the one that has gives you more information. Yeah, switched it because of the quotations. Yep, and he talked about the relationship. And that's normal, right? Because we normally go with exactly what's in the example. But this is just really pointing out your order of operations, right? Your order of operations is that you want to do your comprehensive assessment, and then that will encompass probably everything, not just B. It doesn't just kind of pigeonhole you into, okay, B is why the client is having issues, but D is like, let me get all the information. Okay, let's do three. All right. So this is a research question, clearly. And it really was about, what is internal validity? Um, so we had a few people pick B, but most people picked A. Um, B is actually external validity. Generalizability is external validity. Can I apply my findings to a broader population, and that is going to be external validity. Internal validity really looks at what can I attribute my outcomes to. And so if I have multiple variables or multiple factors for explaining my effectiveness or explaining the outcome, then that might threaten my internal validity. So just a reminder, don't forget to study reliability, validity. Okay, let's do 4. All right. Ethical, yep. It's an ethical issue. But also it's yeah, it's definitely ethical. When you have an ism, any type of ism, right? So the social worker is worried that there might be some type of discrimination happening, okay? What is going to be our go-to action? When we think there's some type of discrimination or some type of ism happening, some type of social injustice, what is our ethical responsibility going to be? Mm, So we love to report. We are referring to the code of ethics, yes. When we have an ism or some type of social injustice, our responsibility is to promote social justice. I always say that means advocate. So when we know that there's some type of ism happening, our responsibility is to advocate on behalf of this population that needs some advocating. So does that mean reporting? It could mean reporting. But really the key word here was advocate. So we want to get some data and raise the concern through appropriate advocacy channels. That makes it a little broader, right? It's like we're going to advocate on all levels, whatever level we need to take it. That's what we're going to do. Um, so A, although sounds right, um, we want to make sure that we collect thorough data and address the concern through appropriate internal channels, meaning that reporting it to the school board is not the only way that we could advocate, right? We could also advocate on other levels um, to make sure. So we think there's something going on, right? But in order to really convince other people that there's something going on, we have to have some type of data, right? They're not going to just be like, "Oh, well, your feelings, yes, your feeling is right." And so you might have assumed that when it said confirm this trend, that meant you already did some data. Right. Yeah. I picked A because of the sentence. Yeah, confirmed. I know how you think. I know. Um, but you don't want to jump too far ahead. You don't want to jump too far ahead. We want to be able to, we can advocate on all levels. So now that we have this suspicion and we've been monitoring it and we're really like, oh yes, this is definitely something that could get out of control. We want to advocate for ways that we can make sure that it doesn't, right? Because remember it says potential, right? It's concern, you're concerned about the potential for systemic bias. And so you want to make sure that you are kind of staying ahead of it, you're advocating and making sure that there are things that you can maybe discuss with leadership about how they can do something about this. So basically, you didn't, A is like you skipped everybody. You skipped the principal, you skipped the vice principal, the dean of students, or who you skipped all the leadership and went straight to the board. But typically we don't do that quite like that.
Okay. Can I say something? I'm sorry to cut you, Miss Brown.
Sure, go
Oh,
ahead.
yeah, I'm so sorry. Um, Looking at the question, if the last part says first, because you say most, and I think most says like that's the last, because we work with sequence like you mentioned earlier. And then if most should be ethical response, I think most, to me, I think most is to report to because I think that's another trigger and distractor that really meant the confirming the trend multiple months and most. If it was first, I would have said, okay, collect information. Then A will have been report to the board, which will have been most. So I don't know. Can you explain?
Yes. So what you did in your mind is that you said that most meant last or meant like the outcome. But most doesn't necessarily mean that, right? Most, that's why it's confusing. That's why most is confusing. Most is confusing because it could, even though it says what is the most appropriate, the most appropriate could be the first thing you would do, right? So it doesn't always mean that most means what is the last resort or what is the last step. But I understand because it doesn't say first, you didn't put it in order. And then if you would have said first, you would have put it in order. But really what I want you to hear is when there is some type of social injustice, your response is to advocate. And B fits that, right? In terms of ethics, if your client is experiencing any type of discrimination, any type of racism, sexism, any type of isms, right? Um, your job is to advocate. So that's really what I want you to take away from it. And also that most questions can be confusing because it is like first, next, most, best. Like, it is confusing. Um, and also you want to make sure that you're going through your appropriate channels. So typically on the exam, like reporting it over top of the school would probably be something that you would not do at this juncture, right? Now, if it had said that you went to the principal and they denied it, even though you had like the data, and they were unwilling to do anything to change what you have, like what your data says, then you would report it. But so far, what we have is your hunch, your observations, right? You see a trend, but that's really all you've done so far. You're concerned. Yeah, you jumped over the hierarchy. Yes. Yes. Right? You're concerned, but you haven't brought it to anybody to do anything about it yet. So you want to do that first. You want to make sure that it's not community organizing, but it's like organizational stuff. Remember when we talked about organization, we talked about chain of command, we talked about the structure. So that's also typically reporting it to like NASW or the ethics committee typically would be like a last resort. Yeah. The trend almost got you. Yes.
Okay, thank you.
No
And that
problem.
that's why we're advocating that they should take this most first nest. It's just too much.
I know. I know. It's a lot. It's a lot. I understand. But what I want you to write down is when there is any type of discrimination, any social injustice, you want to advocate. You want to promote social justice. That your ethical responsibility is to advocate, to make sure that you are advocating against whatever the injustice is. And chain of command. This is also about chain of command. Okay, let's go to 5. All right, let's see what your answers were. It says psychodynamic, so we already know what time it is. Good, good. I don't know how to say this. I'm not even gonna try. Complex, part of Freud's phallic stage, ages 3 through 6, involves a child's unconscious desire for the opposite sex parent and rivalry with the same sex parent. So the boy's desire for his mother and jealousy of his father are classic markers of this developmental conflict. It is totally normal, but it is a marker for the scenario was describing A. So green, just to remind you, green is the answer. Yellow is our distractor, and then red is what I eliminated first. You will see 3 answer options and 4 answer options until I get the confirmation that the exam only has 3 answer options on it. Then I'm going to continue to have a mix of both. But you should see majority 3 answer options. I believe is still the case, but let me know when that changes. Mix of both. Yeah, mix of both. Yep. They say they're gonna change it, but it's taking a long time. It's taking longer than they said because they said it was gonna happen in um I thought it was supposed to happen last year, but maybe it's this year. I don't know. Okay, number 6. All right. I'm not gonna call anybody out. I don't see all 16 people answering. So make sure, even if you're not putting it on the poll, make sure that you're answering the questions. This tore me up. Okay, so similar to what we just talked about, right? I can just find all the options. I know that's why most are so um they are so hard. Most is so hard. So we have a client. The key here is, come on, Angie. Yes. The key here is multiple, several, I'm sorry, not multiple, several staff members. So this is not just a one person thing, right? So when we address it, it has to be addressed in a way that will capture everybody that is doing it, right? So if it was just one person, then we could probably go to that staff member and say, hey, like, don't do that. Like if it was one person and they kept doing it, they kept misgendering the client, um, then you could go to that person and be like, hey, that's not cool, or like fix it, right? But because it's several medical staff, you want to make sure that it is addressed collectively. Yes, you got the answer right. You did. See? Advocate for leadership to implement training and policies, because we want to make sure that this isn't happening over and over and over again, right? Um that seems like we need to fix that. So this I had these questions, these organizational questions are difficult, right? Because it's not direct practice, it's not really supervision, right? It's more like when you have a collective issue, what should happen? So number one, we talked about this when we talked about administration, that training is a good way of addressing things, right? Especially if there are multiple staff experiencing them. Um, and policy, right? We want to also make sure that our policies are preventing this from happening, right? We want to make sure our policies are inclusive, um, so that we are not perpetuating this, right? So maybe making sure our forms and making sure that our practices are such that we are collecting this information and making sure that we are not misgendering our patients. Okay, perfect. Did great. You did great. Okay, let's go ahead and take a small break. It's 8:05. So let's take a 10-minute break and come back at 8:15. You don't have to sign out. Just we'll come back. Okay. Very good. Alcohol use disorder. There are several DSM criteria for substance use disorder. So you just want to keep in mind those criteria. And we see here some of them that are highlighted in blue. A refers to the immediate effects of alcohol consumption. So we know we have a little bit more than that. C involves symptoms that occur when stopping use. And then D involves mood disturbances caused by alcohol. So B was our answer option that would fit this criteria or fit these symptoms that we see in the example. All right, let's do 8. All right, what should the social worker do first? So it looks like we got rid of suggest behavioral interventions because that is intervention. So we're going to get rid of that. And then we have discuss how parental favoritism may be contributing or normalize sibling rivalry as a common childhood experience. And so the answer is A, discuss how parental favoritism may be contributing to the sibling conflict. Um, the parents acknowledge treating their children differently, which can intensify sibling rivalry. The social worker should first explore how favoritism may be fueling the conflict. Um, Normalizing sibling rivalry dismisses the issue and fails to address the parent's role in the conflict. Okay, let's go to the next one. Okay, what should the social worker do next? We have another ethical question. Okay, we were kind of split. So the real issue is that we are working with a Jehovah Witness family whose child requires an emergency blood transfusion. The doctors are uncertain if the child will survive without the blood transfusion. Despite the prognosis, the parents are refusing due to their religious beliefs. Yeah. So when it comes to children and their safety, right? Um, we know that religion plays a part, but it can get a little sticky, right? It can get a little murky. And so it's something we want to make sure we we do consult um the hospital about, right? Because when we're talking about life or death, like it's one thing if you have a child who a procedure may, improve their quality of life, but it's not necessary for them to live. They can still live. It's just that you may think, oh, getting a cochlear implant improves their quality of life. And they're like, no, we want the child to be a part of the deaf community and culture, right? That's not a life or death situation. That's really about their ability to exercise their decisions and freedoms and all of those things. But life or death, right? Um, you're going to let a child possibly die over that. That's a little bit more. So I'm not saying one way or the other is correct or not correct, but as a social worker, we want to see like this is not something I should be, determining, right? The hospital needs to determine, what the next steps may be because you don't want that child um when it comes to life or death, it's a little different than just I want my child to have this procedure or I don't. It's another level. So absolutely, we want to make sure that we're doing what's in the best interest of the child, um, and the safety of the child. So I'm not saying either way. I'm just saying that we probably need some more some other interventions to see what to do about this. Now, respecting the family's decision is also this is like a ethical dilemma for sure, right? So respecting the family's decision is definitely in the code of ethics as well, right? Um, but the decision, like there are no alternate options. Like the decision is this procedure or the child may not live. Like, yeah. So overall, what you need to take away from this question is that religion, culture, family practices, all of those things are fine until they threaten the safety of a child. We we do not say, well, because of your religion or because of your culture, it's okay to do that. If it is threatening the safety or if it harms a child, then we have to do something about that, right? If it were an adult, then we would respect their wishes. Yeah. Yeah. If it's an adult and they're saying, I don't want this procedure, okay. Right? We're going to respect their wishes. But a child, right? It's almost like we want to make sure um what's in the best interest of the child. And I know religion is so touchy. Religion is very touchy. Um right? Because it's like, how can we tell the family what to do with their own child? Um, so I get that. But the same thing, we could say the same thing about culture. Like, how are we, how can we tell someone how to discipline their child? Well, we can. we can when it comes to the safety of the child. That's what we yeah, that's why we have these different systems in place. I'm not saying it's perfect, but I'm just saying when it comes to harm to children, then we have to take some more things into account. It's not just cut and dry. Yeah, we have to really see, okay, is this going to harm the child or is this threatening the safety of the child? And this is a hard one because of religion. Culture is always hard too. Culture, religion is hard. Um, but that's the system right now. That's how we operate. And so
Okay.
it's not that we're not going to consider religion or consider culture. It's not that we are discounting or putting down the culture or religion. We're just making sure that the cultural practices or the religious practices are not threatening harm to a child.
Okay. But excuse me, so I'm gonna say this. But I know there's a common law for medical neglect for children. Are we gonna be applying that in the I mean that's in reality, but does it apply to the questions?
About medical neglect?
Yes. That
Mhm.
no parent is allowed to, I mean, for CPS, if a child is taken to the hospital and parents are refusing, I think most times they call CPS and they charge the parent for medical neglect, regardless of their religion. I don't know if that's.
Yeah. So did you are you trying to say why isn't it B?
No, 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 I'm just saying it like
Oh,
in
okay.
reality. And I mean, if
Yeah.
if it cross across, because the exam is one, but I don't know if it cross across other state or jurisdiction when we're mentioning culture or religion. But I know in Maryland, if a child goes to the hospital and the child is about to die, like we have here, if a medical neglect is, the police and CPS are involved and parents are being charged. I don't know if other states do that. I'm just saying.
Yeah. And it says, the other part is that it says next. So I'm C is not saying you're not going to do B. C is just saying that's kind of what will help the social worker figure out like kind of like next steps. So basically like what happens with the child? What should we do with the child? In like health wise. Should the blood transfusion be given or shouldn't it? Right? Um, and so that's why it's C, but it's not saying that other things would not take place as well. All right. Got some good ones for you. I told you they were good. All right, 10. Okay, this question. Okay, we still did good with it. But this question is going to be more for my clinical test takers. I'm not sure how many we have in here tonight, but I wanted to show how assessment questions or just direct practice questions may look for on the clinical exam. And so on the clinical exam, you're going to see a lot of like you're addressing presenting problems versus in the master's level, it's almost like your answer is to assess, whereas your answer on the clinical exam is that it's really focused on the presenting problem. So if you have, you see that your client is having issues with putting their parents' needs first, feeling guilty about prioritizing their own needs, changes their opinion or plans to avoid conflict with their parent, and that is definitely codependency. So the answer is A. The client is displaying signs of codependency. Um, and so helping the client to understand the pattern so that they can work on, all the other things. So addressing kind of the problem, like this is the this is what the symptoms match. The symptoms match this. And then we can talk about like how to address this codependency. You were holding your breath. Hopefully, it was a good result. Okay, let's do 11. All right. What is the primary reason for this action? What action? What is the primary reason for this action? What is the action? There we go. Yes. Peer support group. Peer support group. So when we implementing the peer support group is based upon them doing a survey. So by them implementing this, it is responding to the survey that they sent out. So the answer is engagement of stakeholders. I know. I already know. I already know. So validation typically I know. I already know. That's a lot. Validation refers more to emotional acknowledgement, right? Like like you're validating feelings, right? That's more of a direct practice word. This is actually more of an organizational, more macro. It's a macro question. And so B, engagement of stakeholders, right? The stakeholders are those who are the subject, right? Almost, or those that are the ones affected. So if you have an agency and they're worried about their social worker stress levels and professional support needs, right? So they are the stakeholders. They are the ones that you're trying to address. So validation is more of a direct practice thing to do. B, engagement of stakeholders is a more organizational thing to do. I started to select stakeholders, but then I selected validation for thinking they were validating the staff. Yeah, but yes, they are stakeholders. Yes. So remember, go with the first one that comes into your mind. Not the first one you pick, but the first one that comes in your mind. So that was really the only thing I wanted to point out is that validation is more of a direct practice thing, whereas B, engaging your stakeholders, making sure that you are engaging them, making sure that you are involving them in what you do is going to be key. Okay. I got to put those macro ones in there because they always blow your mind. So I need to make sure you you get lots of exposure to those because they're always like, what is this? What kind of question is this? What is the point of this? Okay, so out. All right, we got our first 100%. The answer is A, provide education on age appropriate developmental milestones. 6-year-olds typically still require some type of supervision, right? They are not trying to do things like homework and wake up on time um, on their own. They're still working on their independence. And so it's important to remind our parents about that. All right, let's do 13. All right. What should the social worker do first? All right. I think we got it down packed. Advocate. We got it. I think we got it. Just wanted to make sure. All right. Let's do 14. I have 23 total questions. I'm not sure if we'll get through all 23. But let's see how far we can go. All right, 100%. Good job. Explore the impact of enmeshment in the mother-daughter relationship. And we can see that about we see the best friend, they do everything together, relies on her daughter for emotional support. Perfect. Okay, let's do 15. All right. So this one's a little tricky. When we have a client that is experiencing some domestic violence or interpersonal violence, it can be difficult in terms of being sensitive to what's going on. Um, so B, this question is about self-determination. Helping the client to explore her feelings and options allows her to process the situation without the social worker making decisions for her. No one picked A, but C may be valid information, but stating it outright may not support the client in making her own decisions. Instead, the social worker should facilitate exploration, making before making any direct statements about abuse. Okay, I answered how I wanted to, not by how the exam would expect me to. Okay. Yeah, the exam is hard, right? Yeah. It's hard because we want to be like, look, this is what's happening to you. And sometimes psychoeducation is important. Um, but the client is coming to you about the controlling behavior. So there is some sort of awareness there. So it's not that the client is not aware that the partner is controlling them. So we want to be sensitive. We want to explore some options, see how they are kind of what they're thinking. It's very client centered, right? Get their input, see what they're thinking. And very aligned with self-determination. Typically our way of dealing with things we know they like shouldn't do. Like this is not good for you, but it's not a safety issue necessarily, but it's not good for you. We want to offer options or explore the pros and cons or do things like that that respects their self-determination, and hopefully we can not persuade them, but we can present some information, but we can't be like, hey, you need to leave, you should leave. But we can say, let's talk about like how you want to respond to these behaviors that you are concerned about. Okay, let's do 16. Very good. Brief psychotic disorder. This is diagnosed when an individual experiences sudden onset of psychotic symptoms lasting at least 1 day but less than 1 month, with eventual full return to baseline functioning. It wasn't B because that requires symptoms to last at least 1 month and less than 6 months. So it's a longer duration. And then delusional disorder involves non-bizarre delusions without other prominent psychotic features. So very good. Okay, let's do 17. Good job. Enter into a memorandum of understanding that outlines expectations and responsibilities. This is a hot topic. A memorandum of understanding that was not on my exam when I took the exam. So, things that you may see, I think with macro practice and community practice, they are trying to integrate different things like MOUs and nonprofit status just to make sure you kind of understand the organizational side of social work. So perfect. Okay. Very good. Wait a minute. Let me make sure. Oh yeah, this was the key here. This is why I made sure to do a question on this one. So you could see the different family therapy approaches. So Milan is going to be focused on neutrality and circular questions. Those were the two things that, yeah, just need to review those. Because I was like, oh yeah, everybody got it right, structural. But it was actually Milan. So just understanding the differences between the family approaches. So structural, Milan, Bowen, and strategic is the other one. So just refreshing yourself on what, and when you look at it, you just want to see what the key features are. So when I send out the recording, by Friday, I can give you kind of like a similarity and differences for family therapy approaches that will help you kind of just see what the key differences are so you can pick out those keywords. Okay, 19. All right, what is the best action for the social worker to take? Remember, this is like one of these, what would I do versus what the exam wants me to do. So we look at confronting as just talking about a subject like in a firm way. But on the exam, confrontation should be used in a therapeutic way. So instead of confronting the client, we just want to see kind of where the behavior is coming from. How can we connect this to maybe something we've been going over in therapy? Or is this connected somehow to something that we are trying to address with them? So it is important for the social worker to explore and assess the possible clinical meaning of the behavior, even though you might be annoyed. Like really, you're annoyed and you need them to stop. But the exam wants you to figure out why they are having these behaviors, versus just telling them to stop the behavior. Okay, let's do 20. Good job. Explore the meaning of the gift. The Code of Ethics advises social workers to consider the cultural, clinical, and relational meaning behind a gift before accepting or declining. Exploring the client's intent helps to assess whether accepting the gift would affect professional boundaries or the therapeutic relationship. It also is a great way of kind of making it talking about the purpose behind it, the meaning, um, so that you can let them down gently. So you can say, "Well, why does this mean so much?" Um, and we may probably decline it, but we're going to talk about it first. Like, let's talk about, why you want to thank me, or why is this so important for you to give me this gesture? Um, and then we probably would maybe decline it. But in your real practice, if you take the scarf, it's not saying that there's something wrong with taking the scarf. Pray I stop second guessing. I know. It is very normal. Just keep practicing, keep practicing, keep practicing. But very good. Okay, 21, 22, and 23. So we got three more. All right, very good. Splitting. In this scenario, the client is employing the defense mechanism of splitting, categorizing people as entirely good or entirely bad. Very good. Let's do 22. All right, 100%. Report that thing. Yes, report it. Gotta report that thing. Um, Safety question, visible bruises. We know who did it. All right, report it. Perfect. This is our last question. Okay, very good. Arrange to speak with the client alone. This scenario includes several common red flags of youth sex trafficking, such as being underage, accompanied by a controlling older adult, vague or scripted responses, So being able to meet with the client alone to assess the client for sex trafficking would be the best option or best action. Um, A, meet with the client. What? A, meet with the client alone. Okay. So the answer is C. Let me make sure I change that in the thing. So C, arrange to speak with the client alone will be the best action. There was a confirmation of sex trafficking. Oh, I see. A, okay, yeah, A, we not there yet. Because I was like, what? That doesn't make sense. Okay, so the answer is C. Yeah, torn between A and C. Yeah, the answer is C. So we can figure out what's going on. So we have suspicions and we just want to speak with the patient alone so we can see if there are any more red flags and see what's going on. So it's another situation where in this case it's saying what's the most appropriate, but it also is kind of like the first thing you would do, right? Is to get more information about the safety issue, and then report it after you get more information. So how did we do? How do we feel? That's 23 questions we did. We slowed down a little bit just so that we could work on your processing and how you're looking at the questions. Um, and we found out that you know a lot. At least that's what I feel like. You know a lot. You're doing great. There may be some areas to brush up on, but the most important thing is to brush up on your confidence and your trust in yourself. How are we feeling? Okay, feeling good. Yeah, don't have to prove it. You just want to get some more information to see if it's happening. Yeah. Good, but worried since it's not scheduled until January. But you have the ability to really plan, do some full practice exams in that time, continue to use your behavioral health app. So what I want you to do is to make a plan for it's like an aftercare plan. So the groups are over, but I want you to make an aftercare plan. On top of your list on your aftercare plan is those macro community questions. It's top of your list. Keep reviewing that. Keep reviewing your code of ethics. Keep reviewing those things that after we went over things, you're like, oh, I need to brush up on that. Or, oh, I'm still confused. Right? Make a list. Make a list of your strong areas. Make a list of those that you need help in. What might be good too is print out or look at the outline, your knowledge, skills, and abilities. Look at that outline and see what are some areas that I need to review. But definitely macro, definitely ethics. Ethics is just always a go-to. You can never go wrong with reading the code of ethics again and just reviewing it and reviewing it and reviewing it. Try to make a routine and make a plan of what you're going to do. How long after the night will be able to view the live sessions? Yeah, so you will have it by Friday. Is normally when I send out the email. I have all good sense to send it out earlier, but it typically just ends up being Friday morning. um, but yeah, I'm gonna send you the recording. You have the questions already, but I'm gonna drop them in the chat one more time just to make sure you have them. So you can view those. I want you, because if you're in this class, you should have access to the course. So I want you to go over, I want you to take that exam. What I'm gonna do is I'm gonna go on there and make sure it's split into two. So you can do 85 and 85. So you can take them separate, or you can do it all at, do it all at once. Take the first 85, take a 10-minute break, and then take the second 85. And you have 2 hours for each part. So after you take those questions, I want you to keep in mind everything you've learned. I want you to not second guess. And then I want you to let me know what your results are. Like, send me, it should give you a report once you finish the exam. Send me your report so I can see what you need to work on. Any questions? Comments?
Is there a timeline? Is there a timeline when we have to take the exam, or we just take it whenever?
For the one on my course?
Yes.
No timeline. Just whenever you do complete it, let me know, let me see what happened. Let me see your results. Let me see, so that way I can tell you, hey, you need to work on this. I do tell you how to interpret the results on there. The way that I did it was I sectioned it so that it would be easier for you to identify which areas you need to work on. But I want to look at them too, just to make sure you're on the right track and kind of guide you. So you may be like, hey, my test is in 3 weeks, so you want to take it this week. Or if you're like, hey, my test is in January, then you might be like, okay, I'll take it next month, or, so whenever you take it, let's email it to me. Email me your report, or say, hey, Dr. Boone, I want you to look at my results for my exam so you can tell me what I need to study. Anytime you are looking at your practice questions, you want to study that rationale. That's where the butter is at. It's almost just as important for you to know what the answer was not than what it is, right? So if you can understand why an answer choice was eliminated, that is also very important. Yeah, you want to study that rationale. That is going to help you really understand what is the exam trying to get me to see. How do I answer these questions, right? It's really going to help you with that. I want you to feel better. So I'm glad you feel better now. Feel more confident. And every time your mind starts going to that place, you know what I'm talking about, that place that you don't need it to go, that negative place, make sure you're addressing it. Don't just allow those negative thoughts to live in your mind. Make sure you're addressing it. Make sure you are implementing those things that you're telling your clients to do, right? Those grounding practices, those calming techniques, right? Relaxation, you want to incorporate that. Sometimes, you know, doctors will say, they make the worst patients. Same with social workers. We make, we tell everybody else what to do, but we can't get ourselves together. So make sure you're using your own techniques on yourself, okay? So that you can really embrace this journey, because as much as it is professional, it is also personal. It can be spiritual. Um, and so you want to make sure that you are holistic, right? You're holistically approaching this, not just this is what I need to know, but this is the type of way I need to approach this emotionally, mentally, spiritually. This is how I should be approaching this exam, um, so that you can get the end result. And please let me know if there's anything that I can do to assist, or any questions that you have about your personal journey. You can reach out via email. And then I will let you know if I have anything before the end of the year. I'm thinking about it. Probably in December, like early December, I might do something. But you have all the recordings, you have all the materials. Use them, continue to use them, continue to get as much information, as much exposure as you can to that content, just so that you're keeping fresh, okay? But I am so honored to have had these groups with you all, to get to know you all a little bit better. And I am rooting for you. I am sending positive vibes. I am praying for you. And I am so can't wait to hear about all of the things. So please keep in touch. And let me know. We can process things together. For sure. So please keep in touch, and I am here to support you. Oh, and holidays, for those that have test dates like in the midst of holidays, you're not studying and eating turkey. You're not. So it's okay. Be gracious to yourself. Holiday time, nobody is trying to study when family is over, You gotta pay attention to the drama. You ain't worried. So it's okay. Be graceful. I have mine in 2 weeks. Okay. Yay. Yes, yes. Send in positive vibes. Well, have a great rest of the week. And I look forward to hearing from you. Thank you so much.